Hello, I'm Dr. Ian Strawford and I'm the Medical Director of Skin Excellence Clinics. Welcome to this Q&A session. I'm going to share with you lots of questions that I'm often asked when patients are coming to have a consultation with me.
What is the Nefertiti Lift and how could it help me?
So, what is the Nefertiti Lift? This is becoming a very popular treatment. It's something actually I've done in the clinic for over a decade or so. So the Nefertiti Lift is where we're using botulinum toxin to address the depressor muscles of the lower face and neck. So a lot of people, especially women, the platysma muscle, well, this muscle is a muscle that is predominantly a superficial muscle in the neck. It envelops the anterior neck, but it comes up and it attaches into the face, and it attaches all the way up to the muscles, and with the muscles all the way up the face, even up to the temple area here. We activate that muscle when we're smiling, when we're moving. You can see my platysma, it's really active. And what does it do? It pulls the face down. It's the opposite. Most of our muscles work in pairs. One lifts, one does something else. Biceps, triceps, one does that, one straightens the arm. In the face, this muscle is pulling down and the facial muscles lift up, okay? It's a tug of war in your face. And unfortunately, the platysma muscle often is the winning team. It's pulling down more than the facial muscles can lift. And so the Nefertiti Lift is where we're very carefully injecting small amounts of Botox into the platysma muscle and especially if you have these bands of muscle that you can see it pulling down. So we're injecting into the muscle, we're injecting in the lower face and along the jawline. We're also often injecting the depressor angularis muscle, which is a muscle that pulls the mouth corner down, and the chin muscle, mentalis muscle, because they're all active and they're all pulling the tissue down, the facial tissues down. So when we Botox those areas very carefully, it is a very skilled procedure that I've done for a decade or so, is that it releases the superficial part of that muscle and it weakens the tug of war for that team. So it allows the lifting muscles to sit in a higher resting position. You actually physically get a lift of the facial tissues as long as you don't have severe laxity. So we see a significant lift, especially in the younger patients, patients in the 30s and 40s who've got a very active platysma muscle. Then you will see a very nice lift, almost like you've had a little mini facelift in some patients where everything's lifted back up. And so it's a great treatment. It's definitely a preventative treatment because those patients we identify that they're going to get significant laxity issues as they age, as that muscle keeps pulling and pulling the tissues down. If you leave it too long, then obviously the Botox is not going to have enough effect to lift those tissues, and you have to look at other things to lift the facial tissues, whether that's surgical or non-surgical. So in the early stages of aging, it's a great treatment to consider. And I always discuss it with my patients who are coming in their 30s, 40s, and maybe 50s. We address that. We look at that, we assess that, and we address that. It's something that I was getting. And really educating patients around that. Once patients start having that treatment, if it's appropriate for them, it is a treatment they'll want to continue because you are slowing the aging process down. And it was dubbed the Nefertiti Lift by the doctor who basically developed the technique many years ago. And there are many qualified, very highly, you tend to find the Nefertiti Lift is offered in specialist clinics like ours, where we have practitioners, myself and our nurses who are highly experienced in Botox to do the Nefertiti Lift. It needs to be done safely because if you're injecting too much in the wrong place, then the complications of the Nefertiti Lift can be an asymmetric smile or even worse, affecting the swallowing muscles so that you actually are in real trouble if you affect the swallowing muscles, or even neck weakness so you can't do certain movements with your neck. So it has to be done precisely and skillfully, and so make sure you seek the right person to do that treatment when you have it.